You are talking to Mr. and Mrs. Jacobson, parents of a 3-week-old Bethany. Background information: Bethany was born a term after an uncomplicated pregnancy and required no resuscitation at birth. She has struggled to open her bowels since birth, and on further questioning, you find out that she did not pass meconium within the first 24 hours of life. Your consultant have reviewed Bethany on a number of occasions. After discussion with the surgical team, it was decided to perform the rectal biopsy the following day to exclude diagnosis of Hirschsprung's disease. So the task is your consultant has explained to Bethany's parents the need for a rectal biopsy, but now has to go to clinic and has asked you to have a further discussion with them and to explain the procedure. So the task is explain the procedure of Hirschsprung's disease in this case. So I will set the time for both of you. So when you start, let me know. If you're drawing a picture, there is a
you need to share a whiteboard to draw the picture. With this, I
cannot
can
draw here in this.
Let me try.
Try it.
No.
No, really.
I'm on laptop, so
I can draw actually.
You can?
Yes, you see, I can.
Can
you see this one?
Yeah, let me see whether maybe I can and annotate. Okay, I can. Yes.
You can, okay. Okay, when you start, I will start the time.
Okay. Fine. So start. Hello, good morning.
Good morning.
I am Dr. Hiren, one of the children doctor here. I believe I am talking to Mrs. Jacobson, mother of Bethany.
Yes, doctor, we are.
How are you, Mrs. Jacobson?
Yeah, fine.
Thanks for coming here today. Nice to meet with you, Mrs. Jacobson. So today I have been asked to talk with you regarding the Bethany's condition. Is this the right time to talk with you?
Yes, doctor, we are worried as Jacob did not pass his first poo, so we are worried what to do next.
Yes, Mrs. Jacobson, I can understand your concern. Actually, today I will discuss with you regarding all this condition. But before we start a talk, would you like anyone else to attend with you?
No, doctor, it's okay.
Okay. So, what are your update regarding Bethany's condition, Mrs. Jacobson?
Yes, as I told you, he did not pass his first poo, and doctor has decided some procedure. I don't know, so we are waiting for that. What is that procedure, and how you will do?
Yes, Mrs. Jacobson. Actually, Bethany has condition called, she has a difficulty in passage the stool, difficulty in passing the poo. So the consultant and the whole team, they have planned to do the procedure called the rectal biopsy. Have you heard about this procedure?
No, doctor, I don't know what is that.
Yeah, so this procedure actually, what they do, they take some small sample of the tissue from the back passage of the Bethany, and the surgeon who performed this procedure is very expert in this skill, and he also explain in detail to you about this procedure when they perform this procedure.
Doctor, why you want to take this a piece of tissue from the back passage?
Yes, this is very good question, Mrs. Jacobson. Actually, in Bethany's condition, we are suspecting possibility of the condition called Hirschsprung disease. In this, uh, there is some, uh, the part of the back passage which is responsible for pushing the pus. It lacks some of the nerve tissue which actually gives the signal and which facilitate the uh, movement of the poo. So in this
What
condition,
is nerve tissue, doctor?
yeah, this is the nerve tissue which is responsible in our body, which provides like kind of a electricity or kind of the signals, so that the motion of the back passage, it moves smoothly, and it also facilitate passage of the pee as well as passage of the poo. So in this condition, we are suspecting probably there can be a lack or absent of this tissue. And to rule out this, we need to collect this sample of the tissue, and we need to do the examination and test of a further test for this. Am I clear?
So, doctor, yes, doctor, this procedure you told me, uh, this will be painful.
This is very good question. I can understand as a keen mother, you are quite worried about Bethany. But Mrs. Jacobson, this procedure is done under the expertise and under the supervision of the anesthetist. Anesthetist doctors, they give anesthesia, and during this procedure,
What is an doctor? I didn't understand you.
yes, I will explain you, Mrs. Jacobson. These doctors, anesthetist doctor, they give a special medicine either through the tube, or they give some special gas which makes the baby sleep, and then baby doesn't feel pain. So this procedure carried out without any kind of the pain.
So you mean to say this is not a procedure? This is kind of operation. You are giving sleeping medicine, doctor. There will be some risk for this operation.
Yes, this is very good question, Mrs. Jacobson. Yes, there are certain risks. Uh, like there can be chance like procedure may get failed. There can be some possibility of the bleeding to occur, and there can be some possibility of the infection to happen. But fortunately, we are you are under
6 minutes.
the best.
6 minutes, boss.
Okay.
Doctor, there is no alternative to this to diagnose this.
I can understand your concern, but there is unfortunately no other way to diagnose this condition. We need to do this procedure only to know to determine this condition. And regarding the problems like a possibility of bleeding, the surgeon team are very expert in doing this procedure. And for the infection, we usually have a full team who all the follows the aseptic precautions, and the chances of infection as well as bleeding are very minimized.
Oh, okay.
So far,
So
with me.
what should I go if I will do this procedure? My baby will do this procedure. Any any precautions you want to give after this operation should I take at home?
Yes, after the procedure finish, like we will give the specialty nurse will give the specific instruction like before you bring the baby before the procedure. Also, we will advise what to do, and as well as after finishing the procedure also we will guide you like to monitor certain things. First of all, if you are coming through the public transport, you have to avoid that. You need to carry through your own personal vehicle if possible, as well as you need to observe the diaper for a couple of days. There can be possibility like he might feel pain while passing the poo, as well as there can be some blood in the diaper. So in that situation, if it is blood is amount is more than 2 tablespoons, you need to uh, contact the hospital. I will give you the leaflet and I will also give you the contact number so that you can easily ring us back if in case you need the help. As well as you have to also give some medicine as well as, and the some painkiller medicine like ibuprofen as well as paracetamol. You might need to keep it with you, and after that we
Okay,
will
doctor.
follow up. So, Mrs. Jacobson, if you don't have other concern, can I highlight the point which we discussed today?
Yes, doctor.
Okay, so Mrs. Jacobson, today we discuss about the procedure called the rectal biopsy, which is needed to diagnose the condition, to exclude the condition.
Time is up, doctor. Yes, Dr. Rahel, your feedback, please.
That was okay, but little bit, Dr. Hiran, I will say that you have explained each and everything, but it was little complicated. The first thing, you should go directly to, you have done the intro and build rappo. That was very, very fine, very excellently. After that, you should go to direct to the rectal biopsy. And initially, I was thinking which your phrases were coming that this is diagnosed, is confirmed. Then you elaborate that no, we are suspecting. So that was maybe due to some English, as this is our not our language. So then you explain about the Hirschsprung disease. Hirschsprung disease, simply you can say that in this condition, the poo stuck in the back passage of the baby. Normally this bowel work like squeeze and relax to push the poo downward, and that is controlled by the fibers called nerves. Simple, don't no need of signals are going there. This is little bit complicated for a layman.
Nerve is acceptable, it's not jargons, but you asked me what is nerve. So I
No,
go
telling you have used the signal is coming and electrical signals are coming or something you used. I
yeah.
don't think so. That should be used.
But he can
Simply say
ask,
that.
the role player
Simply
can
say
ask, it's okay.
Yeah.
normally bowel squeeze and relax and push the poo down. That is controlled by the fibers or
Mm.
nerves. Okay. And in Hirschsprung disease, these nerves are missing at the end of the back passage. This is only just one phrase you will complete your Hirschsprung disease. We want to check the piece of tissue, to take a piece of tissue from there and to confirm our diagnosis. One more thing, I have written in, I have read from, as this is newborn babies, they are not doing under general anesthesia. They are giving just a sugar
No, actually,
while they are doing this.
in Rebecca, this is the old book. So now in Rebecca, it is given like this sugar and sucrose. But if you see the leaflet of this NHS, it is no more done under the sucrose. It is done
I
under.
have read from the leaflets. I did not read this, Rebecca. I don't know, Rebecca,
Yeah,
what.
also,
What?
I also read from leaflet, it's given anesthesia.
We confirmed in the
Okay.
previous meeting with a few, I think one meeting was there before. We raised this concern, and I think like everyone agreed, like we have to mention general anesthesia rather than the sucrose. But in Rebecca, if you are quoting Rebecca, it is given sucrose. That is there. Leaflet, it is general anesthesia.
Yeah, I have read Reflect. Maybe Reflect was old.
Mhm.
So one risk you forget to tell. This should be very. All you told, this is the normal allergy to anesthesia and the risk of infections or this. One is maybe an injury to the back passage. Perforation can be there.
Hmm, 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 hmm.
Yes. Otherwise,
Okay.
okay. You should be little bit more fast so that you can tell about the procedure, because our they have written that tell about the procedure also. So our task is procedures. You should tell about a small tube will pass into back passage and a small piece of tissue will be collect from there. Will be checked under the
Okay.
Oh, okay.
Yeah.
With this one with the picture, right?
Yeah, with the picture.
You have to draw the picture. Yes, it's one
Yeah,
most
draw the picture.
important.
This, I
And
think
you should tell the small tube will pass into the back passage and will collect a small piece of tissue from there to check under the microscope.
Anyone else has the comment on this one? Any feedback?
What?
Anyone else has the feedback on this communication?
Actually, most of the things are said by Dr. Rohel. The agenda was not clear initially because it's a procedure plan, not the health condition that we are going to discuss. And one more thing, like precaution after rectal biopsy, the child should not be given tub bath or bubble bath for 2 weeks. After that, they can give quick bath, but not a tub bath or bubble bath. Rectal bleeding can occur up to 2 weeks.
Yes.
But if it's more than 2 tablespoons, that Dr. Kiran already said, more than 2 tablespoons, they have to come. They have to come to the hospital when if the child gets fever or unusual pain, that the pain is not subsided by the analgesic provided, or the heavy bleeding. These 3 things, in that case, they have to come back. Anything else? On discharge, some analgesic will be provided. Yeah, bus. And complications of procedure, you already mentioned, bleeding can be there, perforation can be there, and sometimes there can be infection. That the routine complications of the procedure. And Hirschsprung disease, like Dr. Royal already explained, that usually the bowels normally squeeze and relax. This procedure is controlled by nerves, and in case of Hirschsprung disease, these nerves are absent. That's why this and relaxation is hampered and poo gets stuck.
In a simple word,
Okay.
who gets stuck in this condition into the back passage. Simple.
Okay. So yes, simple we can as much as possible, right? So, anyways, this Dr. Hiren, you did well, but I have few concerns. Like the agenda, you came at 2 minutes 21 seconds.
Yes.
Agenda of it's very too late. I think you discussed earlier. The other thing, role player can ask anything. If he asked about nerve tissue, it's okay. Usually, it is not jargon. Some of them they are saying, but some role players they don't know about the nerve. So it depends on the role player, what role player you are having. So if they can ask, so we should be able to explain. This is our job. And the last thing at the end of the other things you already discussed, the last thing, your explanation was too long and without only role player was listening. So we have to at the end you should have to make a little bit short explanation so that you involve the role player, or you can in between ask the role player, have you understand what I'm saying, like this. The rest already you discussed the things, otherwise it was okay.
Okay.
To bring the patient to the hospital, shall we have to say, like, if these things happen, you contact to the hospital rather than bringing to the hospital?
And other thing, see, when like we are not surgeons, okay, so we can also explain them before procedure. A team of surgeon or surgeon will explain you further. If you have any current question, you can ask them even to the surgeon before the procedure.
In the leaflet, they have mentioned that you can come back, but you can contact the hospital. That is also fine. Or you can contact the community nurse. That is also fine. Not a problem actually. Even community nurse can help. She can assess. She can advise to go to the hospital, or they can come back to the hospital, or they can bring to the hospital. Anything okay.
Yeah, anything will be okay. And Dr. Hiran, you have done very nicely. Little bit you were very late. Very phrases were very long, and you want to explain, but it should be in a simple manner. Otherwise, completely normal. I don't think so. This will deduct any mark, maybe one maximum. You have not done any wrong information, you have not given. So that's fine.
Mm-hmm. Inshallah, I will get full marks.
Thanks.
So the next is communication. I'm candidate, my role player, Dr. Irfan. He is in traveling. He will not be there. So anyone of you can be.
I can be if nobody available.
Okay, if anyone no, then you will be accepted. Okay, I'm reading this scenario. The role is pediatric specialist registrar, and setting is the relatives room on a children's ward. You are talking to Mrs. Maggie Stephens, mother of 5-year-old Sadie. Background information: Sadie is a 5-year-old girl with severe CP, cerebral palsy. She is currently an inpatient on your ward. She was admitted 10 days ago with a chest infection, and this is her 4th admission this year. Each time presenting with a chest infection, she has suffered from gastroesophageal reflux for a number of years. She is fed via a nasogastric tube. Her parents have resisted the idea of fundoplication for a long time and have persisted with medical and conservative management of her reflux. During this admission, she has had a pH study and further imaging, as well as being assessed by the physiotherapist and speech and language therapist. Her recurrent chest infections are thought to be caused by aspiration. So, task, you have been asked by your consultant to re-explore the idea of fundoplication with Sadie's mother. So, Sadie's mother is Maggie, and child is 5 years Sadie. Who will set the time?
I will set the time.
Okay, so Dr. Hiran, can you remove the mark you put on the screen?
Just a minute. Actually, you put this whiteboard. Whiteboard gives a very nice
Okay.
that you can draw the way you like. Here,
Okay.
yeah, this is nice. Now,
So are you ready, Dr. Hiran?
Yes, I'm. Just 1 minute.
Dr. Hiran, you will set the time 6 minutes and 9 minutes, okay?
yes, I will set.
Okay, we can start.
Hello, good morning.
Good morning.
Yes, I'm Dr. Bakar, one of child doctor here. I'm speaking with Mrs. Maggie, mother of Sadie.
Yes, I'm mother of Sadie.
Okay, how are you today, Mrs. Maggie?
I am fine, but Maggie is not fine, doctor. I'm quite worried.
Okay, we are hoping for the good and she will find soon. Mrs. Maggie, I'm here to discuss with you about the idea which already has been discussed in the previous visit about Maggie's condition, like the procedure of fundoplication. Is that right time for you?
Yes, doctor. You can discuss.
Okay. Is there anyone else who wants to attend from your side the meeting, like your
No,
partner or
doctor.
anyone else?
I'm alone. You can carry on. No problem. Just I want to know one thing. Why you are discussing again this kind of idea? What's you call fundoplication? Why you want that?
Yes, Mrs. Maggie, this is very good concern, and this is very good question you have asked, and I'm here to explain you. If you feel the information you don't understand, you can stop me at any time and you can ask the question. So let me explain to you about why we are explaining to you again about the fundoplication, because as you know, Maggie's has a recurrent chest infection, and because of her problem in the reflux, which is passage of the food in the stomach, which is comes back into the food pipe called the esophagus.
Mm-hmm.
So because of this, also some in our stomach, which is an organ inside our belly, it has some acids, so it comes also back to the food pipe. That's why Maggie is developing infection. It goes to our breathing system. Is that clear for you?
Okay, doctor, but you told me this is a fundoplication. What is this? What is this fundoplication?
Yes, actually, we have to protect these infection to this passage of our stomach not comes back to the breathing system. So let me draw a picture so that you understand easily. So like this is the food pipe, we called it esophagus, and after that there is a hollow organ. It is inside our belly, which receive the food called
Mm-hmm.
stomach.
Okay.
So what happened? This it received the food, or because of some reflux, like here some junction, this passage of the food comes back to the food pipe, and it goes to our breathing system and cause the infection. Is that clear for you?
Yes, you told me already this one. I'm asking what
Okay.
is fundoplication, doctor?
Yeah, so this part of the stomach called the fundus, so it will wrap up with the lower part of the food pipe called esophagus. So we wrapping up these parts and we make the junction not push the acid in the food reflux from stomach to the food pipe.
Okay. So this will be operation like open surgery.
Actually, it should be decided by the surgeon, but mostly in children, usually they are doing the keyhole procedure called the laparoscopy. They will make few holes in the belly of a Sally, but before that, definitely they will give her some uh, treat some injections or some medicine for sleep medicine, so that she will not aware of the procedure.
Doctor, this as you telling me this is operation, there will be some risk associated with that.
Yes, you are understand. You are the mother about the SETI. So this is the reason, like in every operation or every procedure, there are some risks. So it has also some risk, like it may cause some extra excessive blood. It may cause some inside gases because of this procedure, and sometimes there is some infection and bug infection at the site of operation. But don't worry, we have a good medical team, good surgical team, and they will look after each and every complication.
Okay, doctor. But after this operation, my child will be okay. He he will be okay. Yes.
Definitely, it will reduce the chance of getting this reflux, this push up the content from stomach to the food pipe, and she will not have infection, recurrent chest infection, and also she will feel better.
So you are not 100% sure about that.
Like in every procedure, Mrs. Maggie, so this procedure also has a risk that it will not be successful, but it is very rare, and very, you can say it's a 1% chance. But even though we have a good team, and we will they will
Okay.
do it in under controlled atmosphere and controlled atmosphere.
Anything I mean to say, I can give the food after that easily.
Yes, initially after the procedure, they will give you some leaflets. They will give you a dietitian consult. Initially, definitely Maggie should have only clear fluids. So till that, she will tolerate, and gradually and slowly, within few weeks, she will tolerate the solid foods, semi-solid then solid.
Okay, doctor.
Do you have any other concern or any other question regarding this procedure or Maggie's condition?
No, doctor.
So let me sum up what we have discussed today. That Sadie, she is suffering from recurrent chest infection, and we are diagnosed that we are suspecting it is because of her reflux of the stomach content to the breathing system, and that's why it needs an fundoplication, as I explained to you, and which can prevent her in this infection and also the other problems which might she is suffering from. So I will also provide you some leaflets, and I also provide you some websites so that you can check by yourself, and some also provide you some contact numbers of the support groups if you want, so that you can speak with them and they will help you to understand what is this procedure. Is that right for you,
Okay.
Mrs. May?
Thank you, doctor.
Okay, and also our surgical team will also give you an information prior to the procedure. If you have any query or any question, concern, we can arrange another meeting so that it would be clear for you.
Okay. Thanks.
Thank you very much, Mrs. Maggie.
Thank you.
1 minute.
Still time?
1 minute.
Oh, lot of time.
Yeah.
Okay.
Actually, this is a very small scenario.
Yes.
This is not your fault, Dr. Vakar. This is not your fault. This is a small scenario, actually. You have done very nicely. You have explained each and everything. And you come to the agenda very nicely and very rightly at the time. I think within 1 minute you are at agenda. Just a few things like you should tell about the fundoplication. It's an operation used to treat the gastroesophageal reflux. And what is reflux? Initially you said just a food coming back into the food pipe. You should rather say about this just a food, because the stomach contents you should use, because with the
I should
acid is
use the food or stomach content?
stomach contents also coming
Acid
with the,
including. Okay.
because
Yes,
acid
yes.
coming that is cause this heartburn and each and everything. Food is not so. And one more thing is coming into the uh, lungs, causing the infections. For that, which I am using, you have used rightly, but I am using breath in food into the windpipe. So they are using in UK this word.
What doctor again?
Breath of food into the windpipe.
Okay.
Okay, they are using this in the UK when they are giving some kind of information to the normal peoples. They are using this reflux causing, why this reflux is causing again and again infections. So you can say that the child is breath of food into the windpipe that cause the chest again and again chest infections. Breath of food into the windpipe. Actually, this is not going to the lungs directly. This is into the. I'm just telling
But
others.
this also we should have to be sharp. We should see the role player. What is the education level of the role player?
Yeah, definitely. No, this
If
is
it is
normally they are
from
using this word. This is normally they are using this word, and almost all people are understanding this. Actually, this one I have listened one scenario from UK, and they are saying that we
yeah,
are using breath of food
if
into
it
the
is
wind.
English, if it is English role player, then it's okay. But if it is not, then what? We should use
That's
some.
okay. Otherwise, that's okay. One risk you have just tell me the risk of the normal procedure. You forget few risks, as there can be a failure of keyhole surgery, then needs open surgery, the one. And there can be injury to any part of the like food pipe or the stomach or the gut that can cause perforation. And failure of operation over time needs to rewrapping. You should tell about this one also. They are doing second operation, sometimes it fails, and immediately concern is child may have difficulty in swallowing, or child may have bloating or uh, what's it, burping. So it will take time, and it will be settled with the passage of time. One more thing, you did not tell about the red flags. As you are doing some procedure, you should tell the red flags. I was waiting that you will tell by yourself. That's why I given you the more time. But you left 1 minute. Red flags, like you should tell about the any kind of fever, if the child is having fever, if the child is having pain or increasing the pain, or difficulty in eating, or any other which one. So you should tell about that. Red flags,
Okay, yes,
always
right,
don't forget
right,
red flags.
right.
Like throwing up episodes, or fever, or pain, increasing pain, difficult
But
eating.
this
So you,
throwing up and this bloating, actually, this child is CP on tube, feeding tube, NG tube. So this procedure will not remove his feeding tube permanently. It would be remain on the tube. I know
feeding
about
tube,
this. Yes,
you mean to say if NG tube or gastrostomy?
yes, yes. NG, NG. He's on NG tube actually
Yeah, I
because the
know.
severe CP. So NG will be
Yeah,
remains there after fundoplication. And I
yes.
read it in
You
the
can
this
you
one
can
NHS
remove this
guideline.
throwing up episodes. Other, you should tell
Hmm.
about the red flags. Fever can be there, pain can be there.
Hmm.
These two things. If still NG is there, you should tell about red flags. Actually, they are telling that every procedure. So you are doing every procedure. You should tell about the red flags when the parents should contact to the doctor. You should tell. Even in the
Yeah,
summary,
yeah.
you
Red flag.
can.
Red flag is okay. The other I talk about this throwing up and regurgitation, which is very I think rare in NG tube feeding babies.
Yeah, that can be rare. Otherwise,
Mm.
okay.